A human egg is one of the largest cells in a woman's body. Measuring at 100 microns, it is 16 times the size of a sperm. Although it remains dormant for years and decades, once it is released in a process called ovulation, its lifespan is no more than 24 hours. Hi, my name is Praveena Pai. I'm a Consultant Gynaecologist and Fertility Specialist. I work at the Herts and Essex Fertility Centre, which is based in Cheshunt in Hertfordshire. Today, I'd like to talk to you about the treatment options available for couples or individuals who are struggling to have a baby. Let's start with the first treatment option, which is ovulation induction. In this, what we are trying to do is get the woman's ovaries or encourage the ovaries to produce eggs, and this is particularly suitable in those who are having anovulatory cycles in situations like PCOS, for example. We achieve this by giving them medications like letrozole, which can be taken orally, or sometimes we need injections like FSH. And by doing so, we encourage these ovaries to produce maybe 1 or 2 follicles. This can then be coupled with timed intercourse to help the woman get pregnant. Sometimes another option called intrauterine insemination is also helpful. This is particularly helpful in couples who are finding sexual intercourse difficult. It may be because of vaginismus in the woman or issues in men such as premature ejaculation or erectile dysfunction. It is also helpful in same-sex female couples where they would like to use donor sperms for IUI, or single women who are trying to get pregnant using donor sperms. Essentially, what we do in an IUI cycle is take the sperms, concentrate them, and then take a small volume of really good quality sperms and deposit them into the womb around the time of ovulation, thereby enhancing the ability of this woman to get pregnant. We now move on to another option called IVF, which is something you all probably have heard of, in vitro fertilization. Here, essentially what we are trying to do is get the woman to take hormonal injections on a daily basis so that multiple number of eggs can grow. These eggs are then collected outside the body through a small surgery. The eggs so collected are now mixed with sperms so as to create embryos in a lab setting. Once the embryos develop to a day 5 stage called blastocyst, we are able to then select the best quality embryo and then transfer it into the womb to try for a pregnancy. These days, we also have an added technology called PGTA, which stands for Pre-Implantation Genetic Testing of Embryos, to deselect the chromosomally abnormal embryos, and thereby we take the healthiest looking embryo and transfer it into the womb, which enhances the success rates even more. IVF is a good option in quite a few situations, certainly in women who've got blocked fallopian tubes, in very severe male factor infertility, in couples where there is advanced female age and she is having decline in fertility and wants to optimize and potentially get to a bigger family unit in the time that's remaining. And last but not the least, also in younger couples where other treatment options have failed. The next treatment option is ICSI, which stands for Intracytoplasmic Sperm Injection. It is pretty similar to IVF with one big difference, and the difference here is in IVF we allow a sperm to swim up to the egg and fertilize it on its own. In ICSI, what happens is the embryologist looks for the best, the most motile sperm under the microscope and injects each egg with a sperm. ICSI is suitable in situations where we have poorer semen parameters. It may be either low sperm count, too many abnormal forms, or poor motility. It is also suitable in couples where a previous IVF has resulted in failed fertilization. The next treatment option we can discuss is surrogacy. What happens in a surrogacy cycle is that the embryo or the pregnancy is carried by another woman who's called a surrogate, and she carries the pregnancy for the couple who are known as intended parents. Okay, so this can be used by couples where the woman is not able to carry a pregnancy because it may be a life-threatening situation for her. Or she may have attempted carrying a pregnancy, but we found that her womb lining just doesn't grow well enough. It obviously is also an option for same-sex male couples who would like to try for a baby, and in these situations they use their sperms, they use donor eggs, create the embryo, and then seek the help of a surrogate to carry that pregnancy for them. The next treatment option is fertility preservation. So there may be women or couples who are not quite ready to begin a pregnancy journey, and we now have the option of preserving fertility in the way of either egg freeze, embryo freeze, or semen freeze. If a woman is coming ahead for egg freezing, we know there's a vast amount of data now telling us that the younger the eggs, the better performance of these eggs in giving us a live birth at a later date, and therefore we encourage women to try and do egg freezing before the age of 35.